Welcome to Extraordinary Vets, where every career tells a story. I'm your host, Donna Harris. I'm a veterinarian at Michigan State University's College of Veterinary Medicine and a futurist. To understand the future, we need to look at who is shaping the profession today. This episode's guest is a veterinarian that I only recently met in Mazunte, Mexico. We were both in Mexico helping with a spay neuter campaign that Michigan State, our CVM, conducts, as well as a team from University of Minnesota. Shout out to Dr. Melinda Wilkins for bringing us together. So our guest today is Dr. Christy Lee. Thanks for being here.
Thanks for having me, Donna. I'm excited to tell you about my experiences.
Yeah, we're excited to have you because the reason I'm really keyed in on having you as a guest is because, as you probably are aware, there's a lot of veterinary students that would love to do some aspect of their career in zoo, wildlife, or exotics, and you've
Mhm.
managed to kind of carve out a little niche for yourself. So we definitely want to talk about that. But right now, before we talk about your career pathway, I know you do a couple of, I don't want to call them jobs. You have a couple
Mhm.
roles right now. So tell us about your roles. What keeps you busy now?
Well, currently I'm an associate veterinarian at a small animal hospital, but we also do a lot of urgent care. And it's called Southview Animal Hospital. We're in West St. Paul, Minnesota. So we are open every day, but that takes a lot of doctors. So I'm just one of many on our team. So I see regular appointments, I see urgent care appointments, any species you can imagine. So not only small cats and dogs, but also pocket pets, birds, reptiles, the backyard chickens and pot-bellied pigs, all that.
Let me interrupt for just a minute, Christy. What's a pocket pet?
Pocket pets. So that's your ferrets, your rabbits, your guinea pigs, gerbils, hamsters, chinchillas. Those are usually what we call pocket pets. So they're small mammals, but allowed exotics. In Minnesota, we have pretty strict rules about what we can and can't own, which is great. So they're domesticated animals, right? But I also at that same hospital get to do like soft tissue surgery, dentistry. I don't perform ultrasound, but that's available. And then we also have CT. So it's a great place because we have a lot of options for people. So that's my main job right now. I've been there for 10 years. Previously, I worked at VCA Cedar Pet Clinic. And that was where I got my first experience to work with exotics as well. I would say one of my mentors was Dr. John Bailey. He's still practicing, and he's where I kind of learned how to do the small animal exotics, if you will. I was there for 8 years, and now I'm been at this clinic for 10 years.
Do you see reptiles?
Yes, I see reptiles and birds as well, but there's really only one other doctor at my clinic of 18 that does that. So that's how small of a niche it is to be able to practice different kinds of species. Everyone at my clinic does dogs and cats, but there's one other doctor, Dr. Natalie Keller, and then my boss, Dr. Erin Godinez. She is busy with a lot of things, so she does see exotics, but not as much as Dr. Keller and I do.
Is there a big demand?
Well, it's interesting because we're in the city, so you'd think not a big deal, but there are a lot of different kinds of pets. And I think people get more interested as they watch the internet and what kind of animals they would like to have in their lives. Um, but we have people that come to us from Iowa, Wisconsin, because there's very few of us that will know what they're doing. I will say a lot of vets might say, "Oh, sure, I can try," but it's better if you actually have some experience. So we do the best medicine for them. And with that, at my clinic, one of my biggest clients is an actual indoor zoo called Sustainable Safari. And we have two locations. It's kind of a weird concept, but it's interesting. It's in like two of the bigger malls in the cities. So interactive experiences up close and personal so you can touch these animals and learn about them, and we can teach them how to respect these animals, and hopefully they can learn more and more. But that's where I get to work with kangaroos and capybara and lemurs, otters, trying to think, alligators. So I'm responsible. I'm the attending veterinarian for a sustainable safari, but they're still like our client. So I hope my clinic likes it when we bring the weird animals in. But I also am pretty free to go visit them whenever they need, almost.
I was gonna ask you, do you bring a kangaroo into your clinic or do you go out and visit the kangaroo? Like at what
Yeah.
point do you have to say this animal shouldn't be transported?
Oh, that's correct. That's a great question because there are things that I can do at the zoo. One of the zoos, they kind of built like a small surgery suite. So I can do minor procedures and sedations and kind of have all the things I need, almost everything so far, to do minor procedures. But for example, if we need to do dental work on somebody, then they need to be coming to visit me at the clinic. Or if I'm physically not available to come to them, they can bring animals to us. Melissa Gallup is the main animal caretaker in charge of knowing what's what and how to get animals from A to Z. So she's the biggest part that I work with. She's the biggest, most important person because I talk to her on a daily basis. Like what needs to happen and how is a lot of coordinating, but we do bring kangaroos in from time to time. We've had goats have to come in to do a C-section, so that I cannot do at offsite. So I'm not
Yeah.
exactly as much large animal equipped as I could be, but I do have some experience with large animal medicine too.
With your zoo work, you're kind of mixing it up there a little bit between the small companion animals and things that we think of with farm animals. You're not quite there, but you sorta are.
Yeah, I we just did a farm call for some pigs. They're not pot-bellied pigs, but they were rescued from the local feed place, and I made a call to go to them because they just needed their vaccines. But those people also have horses, so I'm
Mhm.
not the horse doctor. There's something for everyone, and I will say what I can and can't do. But the biggest thing I think I've experienced is that you just have to be excited. I'm the kind of person who gets excited about it and wants to look into it, and I will figure it out. And it's adrenaline, but it's also like exciting because I always wanted to be a zoo vet. So I feel like I'm kind of getting to do all the different things I want to do.
So let's back up a little bit. Did you always wanna be a veterinarian? I mean, do you remember when you decided?
I do remember watching like Saturday morning TV, right? Like National Geographic. It was before Animal Planet came along, and I always wanted to be a zookeeper. And so I could work with big cats. And then my dad was like, why not a veterinarian? It's like, I don't know, that sounds really hard. And he said it is, but you can do it if you put your mind to it and if you put in the work. And so I was like, okay then. And then I also always wanted to learn. So I've always wanted to be a veterinarian, but I can't stop learning. That's the good thing about our job is medicine changes, experiences changes, the need changes. So you have to be ever changing in how you adapt to what you're doing, but also be open to continue to learn, and not just be stuck what we call old school because things change. But yeah, I did always want to be a vet. So, and it was hard
That's
to
pretty
get
cool.
into school. You know, there's not that many vet schools, as you know, so that was the biggest hurdle. But you have to kind of set yourself up for, like, I volunteered in high school at the Humane Society. I worked at the vet clinic as a animal holder, and but then even in undergraduate school, I studied music, but at the same time, my pre-vet studies. So my my college is St. Olaf College in Northfield, Minnesota. I actually have a bachelor's degree in music, but I that was planned because my aunt said, "You should probably have something to fall back on in case this vet thing doesn't work out." So I've always been really interested in music, and that was a big part of my life growing up too, and it still is.
So most veterinary schools don't have a specific track for zoo or exotic medicine. You obviously were setting yourself up to learn by before you ever got in vet school. What did you do during veterinary school to kind of bring in some of that education for yourself?
Right, that's a good question. So I went to Ross University in what the West Indies. It is on the island of
Mhm.
St. Kitts. You'd think, oh, they must have exotic animals there. No, they when you're in vet school, they teach you to go through small animal track or large animal or both, called mixed. There isn't an exotic animal track, so we have to create our own path. So with Ross University, they make everyone do a mixed animal track the whole way. So there really wasn't experience on the island, which is where the school is for 7 semesters. So more I got experience through being in clubs that you can learn about. We had a zoo club. And so we'd have guest speakers talk about what they do and the exotic animals. But really, it was that last year. So your senior year of veterinary school, we get sent back to the US and we get distributed to the different schools based on your GPA, but you can kind of put in where you'd like to be, but you don't get to just necessarily go back to where you want to. So I did get to come back to Minnesota for my senior year, which was a blessing because my father actually had passed away right before we had to like put in where we wanted to go. So I wrote my letter. I said, these are my top picks, but I'd really love it if I could go back to Minnesota, to be closer to my mom. And I don't know if they had pity on me, but they sent me to Minnesota, which wasn't wrong. I would have gone anywhere, of course, but I didn't really take time off school after my dad passed. I think I took a week and I was actually home during that time on break. And so that was also a blessing, right there. The stars aligned and, whatever, my things happen for a reason. And so it was good that I was home, but I knew that my dad wouldn't have wanted me to like be held back because of him. I could have taken a semester off and then just joined the next group, that wouldn't have been a problem, but
Mhm.
just perseverance. I just went back to school and finished. But that senior year in Minnesota, which is the University of Minnesota in St. Paul, um, the externships. So other than the rotations we have, which are 2 weeks here, you can kind of pick what you want to do. The externships is where I really got that experience. I did go to the Minnesota Zoo, which is in Apple Valley, for 6 weeks, and that was like what they required, and that was a lot of fun. I didn't get to physically do a lot because they have people lined up, but to just see how it all
Mm.
works. I went to Oregon. There's a wildlife safari drive-through animal park. And so one of my friends is the vet
Wow.
there now that I was a student with at that time. So I stayed there for a month, and then some of the vet students that were on break came, and then I got to teach them what I learned. And then lastly was 4 weeks in Tanzania. So I raised money
Wow.
because it was the only way I could do this is because I raised money through a Christian veterinary missions group.
Mm.
So and then I was able to meet with American vet and one other student. And we did, again, this wasn't exotic animal medicine, but it's like herd health type stuff. So with cows and sheep and goats, we did some spays and neuters on cats and dogs out there, but more just the experience of different types of medicine and what the need is out there.
Did you go find these opportunities yourself, or did the school help you find them?
I pretty much did it on my own. The zoo was one of the rotations, so I was like, "That's
Mm.
exactly what I'm going to do, and nobody can keep me from doing that." So I did choose that, because other people will go to other vet clinics and, do things, but I really didn't do that. The Oregon Wildlife Safari, I had visited with my family years prior, and the vet at the time had gone to Ross University, so he came to visit us, and he told us about the
Mm.
externships that were available, so I jumped on that. And then the Tanzania thing, that was, I don't know, I met a group of people while I was on the island, and they had talked about different mission trips, so it was a way to kind of explore, but, do good at the same time and teach people. So, yeah, the school probably wasn't I don't know if the school was happy that I kinda cheated the system, raised money to go on a trip, but at the same time, I got credit for it. We did a lot of work out there, so.
Yeah, it sounds like you learned a lot too because you got to work on different species in a different culture, and that's always a learning experience. Right after school, if you thought you were gonna do zoo work, did you jump into zoo work, or what were the decisions then?
That is not something you can just jump into. It's really difficult.
Mm.
You have to write papers and know someone who knows someone, get experience to get experience. It's very difficult. You can't just say, I'm going to be a zoo vet now because I didn't have any experience in that culture. So I decided to do um, a wildlife rehab internship. So that was in
Hmm.
Sanibel Island, Florida, called CROW. It's the Center for the Rehabilitation of Wildlife. Just so I could, again, work with different animals. I was there for a year. And then I went into general practice because I thought to be a zoo vet, you still have to get vet experience to kind of even think about a specialty. But there really is the specialty part of it is hard. There in the state of Minnesota, there's only one, or actually two pocket pet specialists in the whole state, and they're next door to me, so I have
Wow.
access to them. We do not have any bird or reptile specialists in the state, so that makes it difficult to have those experiences to like get experience. But for the zoo, that's even harder. You can go into zoo medicine specialty, but again, how do you do that? It's not so easy to just jump in and get that coin. But
That would have been a resident. When you say zoo medicine specialty, you're talking about a
yes,
residency
yeah.
to do
So
that? Yeah.
and I could have done that in wildlife rehab too, but they don't really need that. I just wanted to have different experiences and then kind of figure out where I wanted to go. If I could have been a zoo vet, I would have, but I just think it wasn't in you can't just jump into it so easily. But, you know, getting experience, even volunteering kind of would help to get those
Yeah.
zoo experiences. Hmm.
Yeah, I've heard a lot of good things about Crow. There was a veterinarian I was familiar with, Dr. Barron. Is she still down there?
I don't know, but she started after I did. So I did meet her
Mm.
briefly. I mean, I was just a student, but it was Dr. PJ was there. And she had left kind of like after I left. But yeah, they do a lot of good medicine down there. And they even incorporate Chinese medicine. So, with herbs and other remedies that we incorporate into the Western medicine.
Yeah, I've heard good things about that place. Good things not only for the public, a place to bring injured animals and they work with things, but also a good place for students to go for externships and like you did an internship. So shout out to Crow for sure. And that's Sanibel Island, right, in Florida?
Yes. Yep. Yep. Just off the coast of like Fort Myers area.
So did your practice that you came to, did they do exotics before you ever got there? It sounds like you're bringing a wealth of knowledge into that practice.
So the first practice was VCA Cedar Animal Hospital. That they already had done some exotics. So Dr. Bailey had worked there. He owned both two clinics with the same name and then sold a clinic to VCA. Doesn't matter. But I was there when he was there. But the one thing he did that I was lucky, other than the pocket pets and birds and reptiles, was he worked with the wildcat sanctuary in northern Minnesota. So I was like, please take me with you. And we spayed lions up there. We neutered a tiger. So these are animals that were kept somewhere and shouldn't have been and end up and stay there the rest of their lives and live happily ever after. So the wildcat sanctuary is a whole nother another area of medicine, but um that's even more difficult. They're wild, but they're friendly at the same time. No such thing.
I hear a little bit of, we all became a little bit more knowledgeable about wildcat sanctuaries with the Tiger King episode that came out during the pandemic. We all didn't have anything else to do, so we watched that crazy show.
Mhm.
But I hear you saying not all wildcat sanctuaries are like that.
Right, right. And this place, like, you can't interact with the animals. Like, it's not open to the public.
Mm.
Um, they'll have some situations where they'll have fundraisers and stuff, and so maybe you can donate things and watch the cats open their Christmas gifts, which is just a bunch of spices or perfumes. They love that kind of stuff. But the animals are treated very well up there. So and then when I moved to Southview Animal Hospital, they had already done some exotics, but not everybody did. So, um, my former boss, Dr. Foster, Mike Foster, he was great because I learned things from him as well. But he also learned from me. So that was weird to me. I'm like, I guess I have some experience, but he would ask me what I think because I came from a good hospital that had high standards. And, as we know, medicine changes. So I kind of was able to work with him too.
So how did you get to work with your inside safari group? I'm asking because I know that a lot of students that are listening to this podcast are thinking, how do you break into that? Okay, I can do some externships. I can, maybe do something in undergrad or to get a little zoo experience, but I don't want to do a residency, but I'd like to do a little exotic work. How did you get involved in that group? How do they make that jump?
Yeah, I had visited Sustainable Safari as a patron, and I was like, "Wait, you can pet kangaroos somewhere?" I was geeking out. I was so excited. So I had gone there. I said, "Oh, this place is legit. Like it's clean. Animals are happy. They're all used to people. So you can pet most of them. There are animals we can't, but they're closer than a regular zoo. And it's a USDA facility, so they have high standards,
Mm.
and they're working on their ZAA accreditation. But so they needed somebody urgently, and I was like, pick me, please pick me. I want to do this. And other people might be like, whoa, no, I don't want anything to do with that. I have no idea what I'm doing. But it was just, turned into a good relationship because they had a need, because they had a vet who was, very, knowledgeable and helpful, but just availability became a harder thing. So then they needed another option. And then they needed to like say someone is going to be the attending veterinarian. So again, I don't work separately for them, but I am their attending veterinarian. So we work really closely together. Your question was, though, how do people get experiences? I've gotten questions from vet students already. How do I do an externship? We don't really have one with the zoo, but I think it's something we could work on. Um, we do have students that come to our clinic, and then I make a point if they're at all interested in exotics to be assigned with me on a couple of those days, and we'll just go there. So again, it's free experience, but it's supervision. It's not just, they don't have a volunteer program, which would be kind of hard, but I don't know. I kind of inserted myself, but there was a need and it worked out.
So it sounds like you've had some great mentors along the way.
Mhm. Yes. Yep. Like I said, Dr. John Bailey, he's in Lake Elmo. So Lake Elmo is Cedar Pet Clinic is where he still works. He's working on retiring, I think. Dr. Foster, Mike Foster, he was my most recent boss, and Dr. Erin Godinez, she's younger than me, but it doesn't seem like it. We get along great, and she helps me to, in certain ways, but we work together. And even everyone I've met along the way, I feel like is a mentor in some way because you learn something, what to do or what not to do sometimes when you work with different types of doctors. So we have different personalities. At the clinic I work at right now, it's pretty high volume. So some people
Mm.
handle that differently. We see a lot of cases, a lot of different types of things happening at the same time, and it's not for everyone. But I learned how to work in that environment, and that's okay.
You've had a career that a lot of veterinary students would love to kind of carve out for themselves. What is some powerful advice that you remember being given, or what might you like to pass on to them as encouragement?
Oh yeah, I would say don't let anybody tell you you can't. If you want to do something, then do it. Yeah, it's hard, or I don't have the money. Well, you figure out ways. You have to have your own fire lit under your butt in order to do it what you want to do. Luckily, over time, I look for those chances and experiences. Maybe they're paid, maybe they're not. That doesn't matter. Like especially when you're first starting, is go volunteer at places. Yeah, it looks good on your resume, but like you actually get experience when you're volunteering. Like even at the zoo, I didn't even work with the animals when I volunteered at the zoo. I worked with the people and helped them find the animals on the exhibit and tell them about the animals. So there's just, you got to insert yourself, like I say, to places where they might not be a position. But if you're you can help them. I guess the other thing that I would say is just like never give up. Vet school was hard, and it yeah, no matter what, it's hard. So, but the reward is better than you can ever imagine. And the things I do, I wouldn't have changed a thing.
Yeah, it sounds like you had a big bump in the road losing your father. I'm sorry about that, and
Mhm. Yeah.
you probably would have been a great vet even if you had taken a semester off. So, but
Thank you.
that's,
Yeah.
good advice about those bumps along the road because we all have them, don't we?
Yes, yes, we sure do. Yeah, and it just happens that you never know what's gonna happen. So life isn't getting it's getting longer, right? But time is something you can't buy more of. So you have to do what you want. I hate to say this, but like life is short. But that doesn't mean be irresponsible. It means do the things you want to do. I'm not gonna wait till I'm 70 to go to Alaska like my mom. I took my mom to Alaska so she could see things before she's too tired to go traveling. But do the things you want to do now. I work a lot, but I work hard and I play hard. So I like to travel and still work those things in.
Yeah. We always think the future's got some big changes coming. What do you think is coming for our profession? What big changes do you foresee from your vantage point?
Hmm. I know. I recently discovered AI medical record keeping, which has been amazing for me because I'm all over the place. I rarely sit still. So, what a program I use right now, like most of us use it, where I just start recording and then it summarizes in medical terminology my conversation with the owners. It weeds out the garbage. It
Mhm.
puts in the exam if I just say it out loud, and then I have to just upload it into the record. So it just saves on typing. I come from a place where we had to handwrite records not that long ago. So it's just even if you don't have to retype it and I hope you didn't miss something, um, it helps with that as long as you can still keep up. So I'm able to not get behind as much in my record keeping. And the other I don't really love AI. It's kind of scary, right? It's like very cool, but I was hesitant because I'm like, I don't know about this. I was too busy to take the time to sit down to learn about it. And once I did, I was like, okay. So I did. But we also have AI as far as like our reading slides and like looking at an ear cytology. I don't know if I'm a big fan yet because it takes a lot longer than a person scanning it, but I don't know. That is something that I think can happen more, and that it'll read a blood slide to take the load off of people, but I do not think it can replace people, because there's discernment that needs to be had when we're, using computers to do our job. So I'm not a huge fan of like virtual visits, but we had to kind of do that a little bit during COVID. For example, when people couldn't come to us, but as long as we had a client-patient relationship, veterinary client-patient relationship within that year, we were able to, talk to them like we are now and, virtually look at their animal and talk about whether this is something that seems appropriate to prescribe an ear medication or antibiotics for a bite wound or something like that. But it can't replace hands-on. It can't replace hands-on at all.
Yeah, we sure had to pivot during the pandemic, didn't we? Well, you sure have carved out a remarkable career. You're doing what a lot of young pre-veterinary and veterinary students would like to do, and so I hope they get some encouragement and some words of wisdom from your advice, your mentors that are now seeing the fruit of mentoring somebody. You're out there doing what a lot of people want to do. So congratulations on an extraordinary career. Thank you so much for being with us today.
Thank you.
Thank you all for joining us for this episode of Extraordinary Vets, brought to you by Michigan State University's College of Veterinary Medicine. This is Extraordinary Vets, where every career tells a story. Be sure to subscribe, and we'll see you next time.